me now is Anne Rimoin. She is the director for the UCLA Center for Global and Immigrant Health, and she's a professor of epidemiology at UCLA. So, doctor, let's start with this testing. Do you really even have a sense of exactly where it's going on? Do you really have a sense of the picture here, or is this just like flying blind?
Well, I think that testing is becoming ramped up faster and faster. But the bottom line is, it's Nancy Pelosi just said, it's testing, testing, testing. We need to get tests up and running. It needs to be widespread. And the longer we lag on widespread testing, the more difficult it's going to be for us to be able to get ahead of this virus at this point. So our hopes of being able to flatten the curve, as we all talk about, reduce the spread, is being able to know how many people are infected. The only way you can do that, more tests.
Yeah, and I wonder why so many other countries are ahead of the U.S. on this.
Testing failures here have been, a mix of government, of lack of long-term funding. There hasn't been funding for a very long time to CDC, to local health departments. All of these things, you need to have them in place before you have an outbreak. The whole idea of preventing pandemics before they start is like you need to be able to, if you have a little nick in your windshield, you want to be able to fix it right away. Otherwise, you start getting cracks and they spread quickly and you're not able to contain it. It's the same story here. We should have been investing a long time ago, and we are now paying the price.
Quick reminder on social distancing. What should people do?
Social distancing is going to be key in slowing the spread. So you want to be able to avoid doing anything in large crowds. Avoiding large crowds is number one. If you don't have to travel, it's a time to reschedule. If you don't need to be going out to dinner, being in places where there are a lot of others around you, it's time to rethink. I think everybody can do their part in being able to reduce the number of people that are out and about circulating. So, reducing or not going to concerts, not going to big sporting events, not going to any big gatherings, following the advice. Right now, I believe they're saying anything over 250 people in some places, don't go. I would say anything that you can avoid in general, meetings, also very important. It's a big change for the American people, but it's going to be important. And everybody has to remember, if we all do our part, we will be able to slow the spread of the virus. And if it works, that's the key with public health. If it works, everybody's going to feel like this was a big fire drill and it wasn't as big of a deal as everybody thought it was. But that's because public health is working.
That is a very good point, and I very much appreciate you bringing it up, Dr. Rimoin. Thank you.
It's my pleasure.